Let's take a moment to consider the role of general practitioners or family doctors and pharmacists in the ongoing support or care of an individual with mental health needs. In the last 20, 30 years, we've seen a significant shift within our communities away from people accessing family doctors and often staying with that family doctor for many, many years or even for their family's generations to an approach where more of us are using walk-in clinics. Now, what we like about walk-in clinics is that we tend to have more convenience. We tend not to have to wait a day or two to get in and see that physician. But the cost to that type of approach is that we often lose that continuity of care about which we've spoken earlier. Now, I understand the reality that, for example, here in Mission, it can be difficult to find a GP who is taking on new patients. And that's an understandable hardship that's occurring across many, many communities here in Canada. But it is worthwhile to try and find that individual, particularly with the person who has a chronic condition, whether it be physical, psychological, or both, because of that loss of continuity. General practitioners here in Mission most of them are a part of what we call the Division of Family Practice, and this includes people who are offering walk-in clinics here in Mission. This is a significant advancement for people in the community because now these doctors are connected to each other electronically through a computer database, so that if you go in and see a doctor for the very first time at a walk-in clinic, he is going to or she is going to have access to your medical records from your interactions with any other physician in that community. So they will have a sense of what prescriptions you have been given, what medical procedures you've gone through, what diagnoses you might have been given. This will help tremendously in maintaining a progressive approach to care, but it will not ever undo the need for us to have a relationship with our general practitioner. It's really important for us to make sure that we are having conversations with the same person, because we cannot make note in a computer database or anywhere about the intangible aspects of relationship or the way that a person communicates. And so a doctor gets to know a person sometimes strictly by observation, and that becomes a part of how they accurately assess whether a person is improving or regressing under the treatment plan that the doctor has put in place. That is something we want to maintain if at all possible. And if we can find a general practitioner, it's important for us to ask them about whatever skill sets they may have some particular emphasis on in their practice. So even though they're called GPs or general practitioners, many of them have developed a particularly strong set of skills or knowledge in a particular area. For example, many are community professionals that are effective in supporting people with addiction issues. Some are really becoming more proficient in dealing with seniors and elders around issues like dementia, largely just because that's what their practice often involves. So it serves to, if you do have an opportunity to ask a doctor about what their particular interests are or where they have particular experience, these are some examples. As we said, relationships really matter. And so even though we can sometimes feel as though we don't have many choices, we should make sure that the connection we have with the doctor is one where we feel comfortable sharing what we think and feel about our own health, and that we can ask questions to find out why decisions have been made and really feel as though the lines of communication are going to be open and trust is going to exist. If we do not have a relationship characterized by trust with our physicians, really at the end of the day, our ability to be treated is significantly compromised. We also want to see that a general practitioner is involved in collaborative practice with other professionals. We want, for example, to be readily referred to other agencies. And if you're listening to this as not a consumer or a physician, but as a community professional, ask yourself whether or not you have made a point of letting the professionals in the community, the doctors in the community, know what you do, especially if it's something where a person can self-refer. They may go to a doctor even though they can be self-referred, and the doctor needs to be able to tell them what exists around the community and how they can go, what processes they can go through to get it. So we need to be collaborative with doctors, and I actually have often over the years chosen my personal physician based on how well I saw those physicians dealing with the consumers I brought to them. And it was always a great test because I could find out very quickly whether or not they had kept up to date in mental health areas, whether or not they were receptive to the consumer, and whether or not they were the kind of professional who would reach out to work with psychosocial rehabilitation professionals or even informal supporters as a way of making sure that their patient was supported well overall. You may not be aware of this, but Mission is nearing completion of a new facility which is being built on just immediately south of the hospital on the hospital property, and this is called the Mission Health Center. The idea behind it is that it's an integrated health center so that mental health, public health, physicians' offices, and other clinics are going to be located in the same facility, just so that it is far easier for people to communicate with each other, far easier for patients to get from one place to the other. And the idea is to really increase the amount of collaboration. And we are hoping that more and more of the social service and healthcare providers in Mission start to try and centralize or create some contact hub through that facility. Now, we spoke about this a bit earlier on. If an individual cannot access the same GP, at least hopefully they can contact the same pharmacist. When we go into a pharmacist, most of the time we walk up to the counter with a slip of paper and come back 10 or 15 minutes later, get a bottle of something and leave. And we are really missing tremendously the power that a pharmacist can bring to our healthcare. So first of all, we want to have the same pharmacy manage us if possible every time, because that way the database will talk about every medication that we're on. Pharmacists are not all connected to each other. I know a lot of people believe that, but that's not the case. And the pharmacist will again get a chance to get to know us a bit as individuals, be able to open the lines of communication and monitor and observe us to some extent in saying whether or not we look like we're improving or not. They can make significant recommendations to us or directly to our physician about the way that our medication is prescribed in terms of the brand, in terms of the dosage, in terms of the times or the number of times in a day that it's given, in terms of the route by which it's administered. So all of these things can matter tremendously. If you work with somebody who's reluctant to take their medications or is forgetful of their medications or who finds that their medication has a nasty taste or something else that deters them, a pharmacist can give you some ideas around all of that. Pharmacists, especially for people in community facilities, can be engaged to do a medication review. If you use what's called an institutional pharmacy, which is a pharmacy that provides medications to community facilities, one of their jobs is to come out, usually every 6 months, and have a look at the medications that a person is on and advise whether or not those medications are intended to go together or whether or not whether there are some drug conflicts. They can also advise about the best and safest way for a person to take medicines. For example, are there certain foods that they should take them with or should they avoid? Should the person stay, for example, in some cases, should they stay off drugs or alcohol? Should they make sure that they take the medicine at a particular time of the day so that it circulates to their body more effectively? Are blood tests necessary for some medications? And they are in some cases. So all of these things can be given to us through a medication review. The pharmacist can help us to develop a dispensing system which will help, particularly if an individual is going to be self-administering their medication. So there are systems that can be created that will make it easier for the person to remember and easier for support people to track whether or not the individual is taking their medicine, and they will have fewer medication errors. The pharmacist can also help us to get information about a medicine so we can be aware of how it works and understand what side effects or overdose indicators to look for. And they can also communicate directly with that consumer in a way that will help the consumer to remove the stigma around medications and reduce the number of barriers to a person not wanting to take medicine. They may be able to advise on foods, lifestyle regimes, or other medicines that can help minimize side effects as well. So that's the sort of thing that we are often not tapping into when we don't access our pharmacists. Family support's the next thing we want to talk about. Family supports are available in almost every local social and health service provider. In other words, if they're providing service to your child, your brother, your spouse, they probably also offer some type of ancillary service that will provide you with support. It could be that they have a support group of parents, could be that they have counselors or social workers that will help you, could be that they have educational materials or a combination of those things. It's very important because most agencies understand that if they are supporting an individual effectively, they're also supporting that person's family effectively. It's very important, therefore, that we ask about those services and let the the service provider know that the family has needs. It's an excellent way to support the consumer indirectly, and agencies really like it when families come and ask for that help because they know that the individual is going to then receive a more sustained and holistic and comprehensive type of help from within their family. Some of the ideas that also exist out there are things like respite programming. Respite simply means that the person gets a break, or we get a break from the person, or both, and that often looks like some funding that is allocated to families or foster families or what we call home share families, so that they can get the equivalent, depending on the individual's need, something like a weekend off a month or perhaps a few evenings in a month. And this just allows the people within the home to have some time away, get a break, or perhaps it's as simple as being able to go out and do your banking and grocery shopping by yourself, just because that might be difficult with the people you're supporting. You may find, as I've said, family-to-family or peer-to-peer support groups associated with an agency, and even if they aren't directly associated, the agency may know of them. You may also, as we said, be able to access education, and in some cases, the agency may be able to actually help you find housing or connect you up with an agency that does that, or help you to establish income support. For example, if you're a person who's struggling tremendously to parent your child, keep your home neat, and deal with the special needs of one of your children, you might want to talk to the Ministry for Children and Family Development, because you may be able to access additional supports, like what we call life skills workers or one-to-one workers or mental health workers. And these are people that would come and work with your child, maybe for 4 or 8 hours a week, teaching them a life skill or engaging them in activities or doing behavioral analysis. You may be able to access drug and alcohol counseling. You may be able to access psychological supports and so forth. And you may be able to access home support, which is literally a person that comes in and takes care of cleaning your home or doing similar housework so that you can focus on your children. Think about any examples that you know of family supports in the community and journal those. And if you don't know of any, take a look at some of the agencies in your community, phone them or look on the internet and see if you can find out any services that they have that might provide support to the family of mental health consumers. And once again, remember that we're not just talking about parents, we're talking about spouses, siblings, and even children of people with mental health needs.